Hey guys, we're back. We're going to dive into the types of Medicare Advantage plans. Again, just a big important factor about Medicare Advantage plans. Medicare Advantage plans are private companies contracted with the federal government or Medicare. Medicare pays that private insurance company to administrate all your coverage when it pertains to your Part A, Part B services. And typically they'll cover prescription drug plans and additional benefits like dental, hearing, and vision. They're going to be equal to or greater than original Medicare, and again, they're going to typically save you a ton of money in comparison to original Medicare. And the great thing is, most of the Medicare Advantage plans that we enroll people into have a zero or very low premium per month. So you're not paying anything unless you use the plan. Then when you use the plan, you're paying very small copay amounts. And then if we're able to walk you through a couple of other key factors of covering some costs that can be out of pocket on Medicare Advantage plans. Most people that choose a Medicare Advantage plan would choose to do an ancillary product that covers most of their hospitalization costs if they ever have any hospitalization stay and have a copay. It covers that. And then if they have a situation with cancer, there's a policy that we do that covers the majority, if not all, of the cancer costs for the year. And another big factor about Medicare Advantage plans that we didn't cover in last section that's very important is Medicare Advantage plans have an out-of-pocket maximum. So Medicare mandates the maximum be $6,700 for each plan or less. Most Medicare Advantage plans now that we're seeing are marginalizing that number down into the $5,000, $5,500, $5,700, but they can go up to $6,700. And what that means is for every copay that you pay for Part A and Part B services under your Medicare Advantage plan, that actually goes into what I call this bucket. And your bucket can only hold $6,700 of your money. So if you were to fill up your bucket, every dollar above and beyond that is covered by your Medicare Advantage plan. So the largest amount of money you're going to pay in a given year for your medical and hospital needs is $6,700 or less. Most people never reach that. Typically, people that are catastrophic event that can occur that can allow them to reach it, or if they're going through chemotherapy treatments, they can reach that. But again, we're going to talk about at the end of how to ensure that type of situation for like chemo or cancer, so you don't have that high out-of-pocket cost. Otherwise, most people pay a few $100s to $1,000 or so of copay a year on their Medicare Advantage plan that don't have a premium. It covers their prescription drug coverage. They have the additional benefits like dental, hearing, and vision, and they love the plans. Now let's dive into the different types of Medicare Advantage plans so you understand. Really, I like to say most Medicare Advantage plans, there's not a big, huge difference in them. For a long time, people were scared of HMO plans in comparison to a PPO plan. They would say, I want to go to a PPO plan. And I would usually ask, why is that? And they would say, well, it has a better network. Well, not necessarily. That's not how networks work for Medicare Advantage plans. And really an HMO and PPO is really a nomenclature. They're very similar in how they operate now. So HMOs are health maintenance organizations, or HMO plans. They provide health care coverage and coordinate a patient's care through hospitals, doctors, and other providers with which the HMO has a contract. So again, we're in Middle Tennessee. So most HMO carriers that are in Middle Tennessee, if they've been here for a long time, they usually have an enormous network of hospitals. Almost all the major hospitals are in network with most HMO plans. Not all of them, but most. The main carriers will have a contract with the majority of the hospitals. Then they're going to have several hundred doctors, if not thousands of doctors, that are part of their primary care network and their specialist network. Now again, you're not going to know by just assuming, well, Kelby said the majority of providers are going to be part of HMO plans, so I'm just going to choose an HMO plan and be happy with it. Don't do that. Don't call into an 800 number and let them guide you into doing that, because that can be a train wreck for you. What you need to be able to do is contact somebody like us that can look up your providers, look up your medication, and make sure that plan covers your primary care, your specialist, and the things that you need on the plan. And then specifically find the plan that's going to cost you the least amount of money that covers all your doctors and medication. That's the goal of when you enroll into a Medicare Advantage plan. You don't want a speed bump, as we call it, going along, everything's going smooth, and all of a sudden you try to go to a doctor and they're not in network. Okay, so HMOs, notoriously in the past, HMOs required referrals to go to a specialist. Now that we're in year 2021 and moving forward over the last couple of years, most HMOs have eliminated referrals. So they're really like PPO plans. Now, what makes a PPO, which is a preferred provider organization plan, different from an HMO? Well, really, the only big difference now is because PPOs and HMOs don't require referrals anymore. Typically, you go to your primary care doctor. Like most of us, if we're sick, we're going to go to a primary care doctor. The primary care doctor is going to diagnose the situation. If they don't know how to figure out the situation, they're going to refer you to their buddy, the specialist. Let's say a cardiologist. They'll say, hey, it looks like you're having a problem with your heart. I've got a specialist that I trust and I'm good, close friends with. I mean, whatever the situation may be, I want to send you over here and allow my doctor of cardiology to look at you because your heart's doing something I can't diagnose. They're going to refer you out to somebody that they know and trust. Well, guess what? Most of you guys are going to trust your primary care doctor to do that. I call them the quarterback of calling the plays. Most of us, if we don't trust our primary care doctor, have enough common sense to find a new doctor that we do trust. So I've got a friend of mine that I play golf with on a regular basis. And typically, if I have a question about medical, guess what? I text him and I say, Doc, I got a question for you. Is this a concern? And usually within a few seconds, he'll come back and say, hey, you know what? You better have that checked out, or you better take your child in and have that situation checked out with your child. So I bounce it off of him, and then I typically go to a primary care doctor, let them assess the situation, and then if we need to be referred to a specialist, we get referred out to a specialist. That's just how most of us access care. Most of us don't pull out the yellow pages anymore, open up to the specialist list and choose a doctor ourselves, because guess what? You don't know that specialist, and you don't know if you really place a lot of trust in with that doctor. So Medicare Advantage plans are driven by networks. They're contracted with hospitals, they're contracted with doctors, and they're contracted with the services that we talked about earlier. Finding the plan that covers the services and the doctors is simply done by using someone or specialists like us that walk through a process. We have a software platform that we use, and we look up that information for you to ensure that your doctors, your medications, hospital, and everything that you use for care is accessible through the plan. Really, the HMO or PPO plans are the two major plans that are players in this area that we live in, at least. I'm going to go over a couple other plans that may affect you. But in choosing an HMO or a PPO, which one do I typically look for? Well, I always ask people, if you're going to go outside of the network of the Middle Tennessee area to get care, like in Texas or Cincinnati to the Mayo Clinic, if you're going to do that, then we would choose to put you on a PPO plan, because the PPO plan allows you to go to out-of-network services at a higher cost or a percentage amount for that service. For HMO plans, typically a standard HMO plan, you're going to go within the network of that plan, which is typically like a region area, say Middle Tennessee. If you go outside of Middle Tennessee, it's not going to cover coverages outside of Middle Tennessee because you're outside of the network. And again, if you live in Middle Tennessee and you live in the Nashville area, surrounding area, and you come to Nashville for care, you know that I don't really need to go anywhere else. If I have cancer, I'm going to go to this hospital or go to this type of specialist. If I have neurological issues, I'm going to go to Vanderbilt. If I go here, and if you're relating with a doctor that's able to refer you out to the proper places to get care, an HMO plan usually is going to be a better fit, because the costs a lot of times are going to be lower. The plan benefits are going to be richer or more. And here's what I like about HMO plans. They have what's called as a continuity of care model in place with most of them. That means the primary care doctor, the specialist, the hospital are going to work together to help manage over your health care. They're going to do a better job in the HMO model than the PPO model. Or like I like to say, HMOs are like marriage. It's kind of a partnership between you, your doctor, and the care that you're being given. And you're going to kind of have this covenantal relationship and engagement model there with your doctor or whoever's providing your care. PPO is more like dating, courtship. You're holding hands, going out, they care, but when you go home at the end of the night, you're kissing that loved one goodbye, and they're going to their place, you're going to yours. And there's a little bit more of a hands-off approach in a PPO model. So I always say, if you really want to have your health care managed well and you trust your primary care doctor and your doctors are providing care, HMO models typically are a better option for that. Now, don't take that and take it into a rural setting and say, hey, I don't have access to care. like that, or there's a small network of doctors and hospitals, I have to drive 60 miles or 100 miles to get to anything. What do I do in that situation? It's going to be different for you. So your situation is going to drive what we consider reviewing over your options, figuring out what's best for you, then walking you through those health plan options. Another plan is called a private fee-for-service plan. These plans really have gone away in a lot of major states, but states like Kentucky still have a fee-for-service plan. Basically, on those plans, there is no network. It works just like original Medicare. You have to call and engage with the doctor or hospital and ask if they accept the terms and conditions of the plan still. There's not a contract, but the doctor has to tell you, yes, we're still accepting the terms and conditions of that plan. They can access the terms and conditions of the plan by the healthcare's website or Access to Care. They'll know whether or not they're accepting that as a fee-for-service plan. Medicare Advantage plans that are fee-for-service plans typically have a little bit higher copay cost, but here's the beauty of them. If you want to go out-of-state doctor, or you live right on the state line to 2 or 3 states, like a lot of times you'll come into a conjunction in a rural area where there's 3 states touching, and they go over into a state to go to the hospital, and they go over into another state to see their specialist. A fee-for-service plan in that situation is a great plan option because usually there's 0 to low premium. The copays are manageable for that member. They have prescription drug coverage part of the plan, and they get additional benefits, and they're happy with being able to go to multiple states or multiple areas to access their care. So fee-for-service plans they're not even available in Tennessee, but in Kentucky and other states they are available. Special needs plans and what we call as dual special needs plans. Special needs plans are typically for chronically ill people that have chronic conditions that can qualify for special needs plans that have lower costs for medication and care-driven needs around the 4 major chronic illnesses that face us as Americans. One of those being like plans specialized in like COPD or diabetes. Dual special needs plans are going to be for those members that are on Medicare and Medicaid. So if you're on Medicare Medicaid, you qualify for what they call as dual special needs plans. Basically, a dual plan covers 100% of the cost of medical and hospitalization needs. Those benefits that are additional benefits like dental, hearing, vision are typically a lot more because the need for that person that's on a fixed income, maybe they've been on a fixed income and you've been on a fixed income for several years, and maybe you have a larger need for dental insurance, and those plans typically will have a lot more richer benefits when it comes to those needs. Again, dual special need plans are chassis typically on HMO plans only, and the access to those are different depending on the area that you live in. But we have a lot of members that are what we call Medicare Medicaid beneficiaries that enroll into dual plans because they're great. They don't cost them anything. They provide a ton of benefits and access to care that they don't get on original Medicare. HMO point of service plans. Those are HMO driven plans, but point of service allows them to go out of network for an out of network doctor visit, hospital stay at a higher cost. And point of service plans are great a lot of times in certain given areas where somebody needs to access a specialist or care outside of their given area that they live in, that they're going to do maybe once a year, twice a year. Again, we just look at what they're going to have done, the costs associated with that, do a review and provide guidance on what plan is going to be the best, either an HMO, POS plan, or sometimes a PPO plan is just the better plan option. And then medical savings accounts. So MSA accounts typically don't drive through most states. Our state, we don't have medical savings accounts. It basically combines a high deductible health plan with a bank account, and there's moving nuances to that plan that you're able to do if you're looking for a Medicare medical savings account. Great. In certain states they're just not available. So if you're coming out of a state that you had one and moving into a state like this area that we live in, there are not MSA accounts or plans available here. Would walk you through a plan typically with a lot better benefits and copay savings than an MSA account anyway. So if you have questions about that, you can always ask and inquire when you give us a call. Guys, we're going to take a break for a second, and then we're going to jump into the prescription drug plans, and then we'll be concluding with the Medicare supplement plans. If you guys have any questions, give us a call at this point, but otherwise, stay tuned. We'll be back with you in just a few minutes.